Lung abscess is an pulmonary disease condition. Look at this picture, shows that lungs, an abscess, chest X-ray findings, shows cavity lesion with air fluid levels. Look at this MRI and CT scan findings. It's provide a detailed visualization of the abscess. Look at this, a detail going on. Introduction. Lung abscess is a serious pulmonary condition characterized by localized necrosis of lung tissue, leading to the formation of a cavity filled with pus. It usually a complication of pneumonia or aspiration and can cause significant morbidity if not treated promptly. Advances in antibiotic therapy and supportive care have significantly improved the prognosis of this condition. A definition. A lung abscess is defined as a localized collection of pus within the lung parenchyma caused by microbial infection. It typically presents as a single or multiple cavity lesions filled with necrotic debris and fluid. Etymology. The term lung abscess originates from the Latin word absciss, meaning going away or departure, referring to the body's attempt to isolate and expel infected materials. It describes a localized collection of pus within the lung tissue, often resulting from bacterial infection. Types. 1. Primary lung abscess occurs due to direct infection of the lungs, commonly seen in aspiration pneumonia. 2. Secondary lung abscess develops as a complication of another underlying condition such as malignancy, bronchial obstruction, or systemic infection. Causes. 1. Aspiration of oropharyngeal secretions, most common. 2. Bacterial pneumonia. 3. Septic embolism. 4. Bronchial obstruction, tumors, foreign bodies. 5. Pulmonary infarction, 6. Hematogenous spread from systemic infections. Risk factors: 1. Alcoholism and substance abuse. 2. Neurological disorders, stroke, seizures leading to aspiration. 3. Poor oral hygiene and periodontal disease. 4. Immunosuppression, HIV, chemotherapy, diabetes. 5. Chronic obstructive pulmonary disease, COPD. 6. Prolonged mechanical ventilation. Complications: 1. Emphysema, pus in the pleural space. 2. Bronchopleural fistula. 3. Hemoptysis, coughing up blood. 4. Septicemia, spread of infection into the bloodstream. 5. Respiratory failure. 6. Chronic lung disease. Pathophysiology. The pathophysiology of lung abscess involves a series of steps leading to the formation of pus-filled cavity in the lung tissue. 1. Aspiration or infection initiation. 2. Inflammatory response. The immune system reacts by releasing inflammatory cells, neutrophils, macrophages to fight the infection, causing localized tissue damage. 3. Tissue necrosis and liquefaction. Persistent infection lead to necrosis of lung tissue and liquefaction, forming a cavity filled with pus and cellular debris. 4. Cavity formation. The necrotic area enlarges and the body tissue to wall of the infection by forming a fibrous capsule around the abscess. 5. Drainage into bronchial tree or pleural space. The abscess may rupture into the bronchi, leading to foul-smelling sputum, or into the pleural space, potentially causing emphysema, pus in the pleural cavity. 6. Chronic abscess or healing. The abscess may persist, chronic abscess, if not treated properly, or it may gradually heal with fibrosis and scarring after appropriate antibiotic therapy. Signs and symptoms. 1. Persistent cough with foul smelling, purulent sputum. 2. Fever, chillness, and night sweats. 3. Pleuritic chest pain. 4. Hemostasis. 5. Weight loss and fatigue. 6. Decreased breath sound and crackles on auscultation. Diagnosis. 1. Chest X-ray shows cavity lesion in the air fluid level. 2. CT scan of the chest provide detailed visualization of the abscess. 3. Sputum culture and gram staining identifies the causative organism. 4. Blood test elevated white blood cells count and inflammatory markers CRP, ESR. 5. Bronchoscopy helps in rule out malignancy and obtaining samples for culture. Nursing diagnosis. 1. Ineffective airway clearance related to thick, purulent secretion. 2. Impaired gas exchange related to lung tissue damage. 3. Acute pain related to pleuritic inflammation. 4. Risk for infection spread due to ongoing bacterial activity. 5. Nutritional imbalance due to decreased appetite and weight loss. Management. First, medical management. 1. Antibiotic therapy. IV initially, then oral. Broad and spectrum antibiotics like clindamycin, ampicillin, or metronidazole. 2. Chest physiotherapy helps in mobilizing secretions. 3. Percutaneous drainage in case of large abscess not responding to antibiotics. 4. Surgical resection indicated for persistent abscess or complications. 5. Oxygen therapy if hypoxia is present. Nursing management. 1. Monitor vital signs, respiratory rate and oxygen saturation. To encourage coughing and deep breathing exercises to promote secretion clearance. 3. Maintain adequate hydration to loosen secretions. 4. Administer prescribed antibiotics and monitor response. 5. Educate the patient on smoking cessation, oral hygiene, and medication adherence. Treatment options. 1. empirical antibiotic therapy, broad spectrum antibiotics, to targeted antibiotic therapy based on culture results. 3. Drainage procedures, percutaneous or surgical. 4. Supportive measures, oxygen therapy, fluids and analgesics. Psychosocial medicine. 1. Patient education, provide knowledge about the disease process and management. 2. Emotional support, addressing anxiety and fear related to illness. 3. Nutritional counseling, encouraging a balanced diet to aid recovery. 4. Family involvement, engaging family members in the care process. 5. Lifestyle modifications, advising on smoking cessation and avoiding alcohol abuse. Prevention. 1. Prevent aspiration by elevating the head while feeding high risk patients. 2. Good oral hygiene to prevent bacterial colonization. 3. Timely treatment of pneumonia and infections to prevent complications. 4. Avoid alcohol and substance abuse to reduce aspiration risk. 5. Immunization against pneumonia causing pathogens. In conclusion, lung abscess is a serious infectious condition that requires prompt diagnosis and management to prevent life-threatening complications. With early antibiotic therapy, supportive care, and proper nursing interventions, the prognosis is generally favorable. Preventive measures such as good oral hygiene, vaccination, and lifestyle modifications can significantly reduce the risk of developing lung abscess. Thank you. Have a nice day.